Welcome to another post of Dr. Blake's Healing Soul.
Hi, I'd like to talk to you about the evaluation of a neuroma. People present all the time with pain in the front of their foot, and we try to get an idea of whether it's soft tissue, whether it's a joint, or whether it's actually what we call a pinched nerve or a neuroma. Morton's neuroma is between the third and the third and fourth toes. So if we number the toes, one from the big toe and five for the little toe, Morton's neuroma is classically, which is the most common neuroma, is between the third and fourth toes. So in examining the foot, you're going to look at the range of motion of the joint, try to find out if it's joint pain that they're experiencing. So you're dorsiflexing and plantar flexing the joint. You're looking for soft tissue swelling, which normally does not occur in neuromas. Neuromas are swelling that's deep in the nerve, but you usually don't, especially when you compare the two sides, you don't see any sign of a problem. And then you get your finger and try to go between the third and fourth metatarsals and try to find if you can elicit the pain. A patient with Morton's neuroma pain has some type of nerve pain. It could be numbness, burning, electrical, tingling, but it could be sharp also, which is harder to differentiate from a stress fracture, say, but it's not just an achy pain or a throbby pain. It's more nervy. So you get in that space. You try to palpate a mass, and of course you always have the other side for comparison. Hopefully the patient only has it on one side, and then what's called Mulder Sign, where you palpate the sore spot and you squeeze from side to side. And if you feel a click, it's called Mulder Sign. And that is pretty diagnostic of a neuroma. Some patients with neuromas have a positive Mulder sign, sometimes they don't. Anytime you're working up nerve pain in the foot, you always have to think if it's coming from above. So you want to, after you look at the local area, you want to tap on what we call the Tarsal Tunnel and see if that elicits the pain. And you do that two ways. You do it where the patient's relaxed, and you tap on it and see if that gives them similar symptoms. And you also dorsiflex and evert the foot, where you put a stretch across that and then tap on it. That's called provocation testing, and see if that elicits the pain. So let's say that does not. So then we're going to do what we call a straight leg test. So we're going to have the patient lay there, knee straight, and I'm going to pull up and try to put some tension on the sciatic nerve. And we go to where it just gets tight in their hamstrings. So this patient has very loose hamstrings that can go pretty high up. And then from that position, and we're asking them whether they feel any nerve pain, whether they feel the same amount of pain. And then I dorsiflex the foot, putting more stress on the sciatic nerve, and I also dorsiflex and evert the foot and see if I can elicit the same pain. So we're trying to see if the pain in the foot is maybe coming from the low back. The next way we can do is called neural tension testing. Is we put a nice stretch on the nervous system, and then we have the patient sit up and curl first their chin to their chest, and then slowly bend their back so that they put as much stretch on the spine and the sciatic nerve. And you're looking for some clue of whether the problem could be coming from above. So I hope that helps you in deciding if it's a local nerve problem or whether it's coming from the low back or somewhere above the ankle. Thank you very much.